Good afternoon, everyone. Am I audible and visible? Alright, so today we have a session on nutrition, guys. It's episode 7 that we are on. So today is the 1st of June. The exam is almost approaching. Please continue studying, continue revising. No need to worry about anything new now. Just keep your concepts clear and move ahead, okay? We had an EPID, vaccines, demo, biostats, screening, environment. Today we are on nutrition, okay? Chalo, so the first question out, can you answer this? 12 weeks primary comes to you for checkup. What is the correct advice you will give to her regarding additional calorie requirement? What is your answer? A 12-week primary has come to you for checkup. Okay? Good afternoon. A 12-week primary has come to you for checkup. What is the correct advice you would like to give her regarding additional calorie requirement? Alright. Now see, some of you are answering 350. I would not say that 350 is wrong. Obviously, according to NIN, on an average, alright, on an average, plus 350 kilocalories, alright, is needed on an average in all trimesters, per 350 kilocalories per day. But guys, here if you look at the options, it is also asking you trimester wise. So I want to show you a table. Can you all check out this table, guys? Ideally, everybody in the first trimester, minimum 70 to 85 plus 350 in the first trimester is not a very suited option over here. Okay? Plus 350, because if you have an option trimester wise, you'll go for that. 70 to 85 kilocalories per day or even no extra. Okay? In the first trimester, technically no extra is needed. If a woman needs less than 100. Second trimester, 230 to 270. So you can remember on an average 200. It's in the range of 200. Second trimester on the range of 200 kilocalorie per day extra. And if you talk about the third trimester, so what happens in the third trimester? Maximum weight gain of the, not maximum, I would say that in the third trimester, what is the weight of baby? In the third trimester, the weight of baby, or in the 7th month of pregnancy, weight of the baby is almost 1 kg. And the baby is going to gain maximum weight during the third trimester. So the maximum calories needed in the third trimester, 392 to 460. So what is it? It is in the range of 400s. It is in the range of 400s. So maximum weight gain occurs in the third trimester, which is in the range of 400s. Okay. If you take out the average of this, it will come out to be 350. Average in all trimesters. Did you understand? But technically speaking, if somebody asks you a question, trimester wise, if you have the option, like additional calorie of 400 in second trimester is wrong. In second trimester, it is in the range of 200s. Additional calorie of 100 in second trimester is wrong. It is 200. Now 350 is okay. But if I have an option which says in the third trimester I need additional calorie of 400, a pregnant woman, we would suggest to go for that one. Is it clear? Everybody, please don't get confused. If nothing is mentioned, if you don't have trimester wise, guys, then obviously you can go for plus 350, because like I told, on an average it comes out to be plus 350. But if you have an option trimester wise, go for that one. Clear? Okay, alright, one more. Suppose a question comes, a sedentary worker male, let's say a doctor, requires how much kilocalories every day? How much calories per day does he require? A sedentary worker male, or let's say a doctor, requires how much calorie? Who remembers it? The RDA. Very good, guys. You remember we had learned 21, 27. Sedentary worker male, moderate worker male. 21, 27. Moderate worker female, heavy worker female. यहाँ पे 1660, that is for sedentary worker female, on an average 1700. Double of that, 3400 for the sedentary worker male. Okay, so I'll just show you a table over here that I wanted all of you to revise. Let's revise everybody. Sedentary, moderate, heavy worker man, 2110, you can write it as 2100, 2700, adult woman 2130, 2100, 2700, 1660. If you can remember, nothing like it. If not, you can do it 1700, double that, this is what? 3400. If you double it, it is what? It is 3400. Clear? First in pregnancy plus 350 in all trimesters. First 6 months plus 600, 7 to 12 months or 6 to 12 months plus 520. Now you are going to add this to what? Plus 350 you will add to what? You will add to 1660 plus 350. Is it clear? You will add this to this one. This is what is needed in pregnancy. If nothing is mentioned, you will take it as sedentary worker. If they mention a laborer, a woman who is a lower socioeconomic class, she is a laborer, then you will not add it to 1660. You will add it to laborer is a heavy worker. So you will add it to 2720. Accordingly, you have to be sure about the question. Am I clear? Everyone understood these couple of points, guys? Don't forget it. Teachers, doctors, nurses, all of them are sedentary workers. Shopkeepers are moderate. Heavy workers are rickshaw pullers. All of them are your heavy workers. Okay? Chalo, let's go to the next MCQ for the day. Alright. RDAs. Can you tell me what is true about reference woman for RDA? What is true about reference woman for RDA? Weight should be 60, height should be 1.62 meters, work should be 10 hours per day, age should be 18 to 25 years. Think carefully and mark. Reference man and woman. Weight, earlier it was 60 kg, now it is no longer 60 kg. Reference man 65, reference woman 55. So let's do one thing. Most of you have got it correct. Good, the answer is this. Let's discuss the this one, the guidelines. Okay, now if you look at the guidelines over here, the age is 19 to 39, reference woman 19 to 39, weight is 65 kg, weight is 55 kg. BMI, this is for Indian classification. So for man it is 20.75, for woman higher BMI, slightly on the higher side, 20.95. The height of a reference man 1.77 meters and for reference woman 1.62 meters on an average. Okay? Activity 8 hours of sleep, 8 hours of moderate work, 4 to 6 hours of sitting moving and 2 hours of walking. Clear? So what was the answer over here? The answer was height 1.62 meters. We'll talk about reference man meaning. Reference man is for whom you have set the RDS. Okay? Alright. Now tell me the answer to this. What nutrient does a lactating female require more than a pregnant woman? So lactating female, vitamin D, calcium, iron, folate. So which one does she require, everybody? Which one does she require, everybody? More. Very good. From here, if you have to select the options, iron, folate, more in pregnancy. Vitamin D is the same. Calcium. Now I'll just show you a chart which would like a 3-star chart. Revise. Nutrient increase during pregnancy, iron, folic acid, protein and zinc. During lactation, calcium, vitamin A, vitamin C, iodine, carbohydrates. This is very important. I'll show you a question on that. Okay? Calcium, vitamin A, vitamin C, iodine, carbohydrate. Now, let's go to an MCQ which will help you revise one more thing, guys. RDA of iodine for lactating woman. What is your answer? Yes, RDA for iodine is 280. Iodine, everybody, is a trace element. It is one of a very important MCQ that comes in the exam. Okay? So RDA for iodine for lactating women is how much? to 80. So refer to this chart. Now I don't want you to learn everything or worry too much about this chart. As you can see, iodine values in pregnancy as well as lactation, 250 microgram per day, lactation 280 microgram per day. ठीक है. Vitamin A also increases. If you can remember the range, that's okay. ठीक है. Vitamin D remains the same throughout. Folate, according to WHO, you have to remember the folic acid prescribed is 400 microgram every day, right from when she wants, at least 1 month prior to she plans on conceiving. ठीक है. And anemia Mukh Bharat, we will take it later. Average weight gain in pregnancy 10 kgs, 9 to 11 kg. But any woman who belongs to lower socio-economic status, the weight gain is 5 to 6 kg. ठीक है. Carbohydrate also increased 200 grams per day, but protein is more increased during pregnancy. So couple of things you should remember from this chart. Particularly they ask you about the values of iodine. Done? So here the question that was asked was RDF of iodine for a lactating woman. We are just doing certain important tables, guys. Okay? Let's go to the next one. Which out of the following is a trace element? What is your answer over here? Which out of the following is a trace element? What is it? Calcium, sodium, magnesium. These are all basics. Please don't ignore such questions. Don't think they might not turn up. They definitely turn up, guys. Yes. What is it? What is it? Some are writing C, some are writing D. Trace element is iodine, which is required in very, very small amounts. But it is very important for our body, but required in very small amounts. So like you can see over here, look. You have certain major minerals: calcium, phosphorus, sodium, potassium, magnesium. Calcium, phosphorus go together, sodium, potassium go together. Trace elements you should remember: iron, iodine. They are very important for your MCQs though. Fluorine, zinc. These are the ones that I want you to remember, and they are very important for MCQs. Iron, iodine, fluorine, zinc. Copper, cobalt, chromium go together. Magnesium is major. Manganese and molybdenum are trace elements. Okay? But what you have to remember: iron, iodine, fluorine, zinc. Basic question. Let's move ahead. Lethal BMI in men is? Guys, I'll just be back. Give me 1 second, okay? 1 second. Alright, lethal BMI in men, what is your answer? Lethal BMI in men is less than 13. That means the BMI that somebody can tolerate, alright, at the extreme level. So less than 13. Less than 11 is what, guys? Lethal BMI in women. Okay? Less than 11 is lethal BMI in women. Alright, just out of the books, although we will discuss it tomorrow in NHP, what is super obesity? What is super obesity and what is morbid obesity? What is super obesity and what is morbid obesity? What is super obesity, guys? Super obesity means 50 se bhi upar. So super is BMI more than 50. Morbid obesity is BMI more than 40. Clear? Okay, let's go to the next MCQ. What is the answer to this? Average daily dietary nutrient intake level sufficient to meet the nutrient requirement of nearly all 97 to 98% healthy individuals in a particular life stage and gender group is known as. What is your answer here? What is your answer over here? Okay, the answer is average daily nutrient intake level sufficient to meet the nutrient requirement of all age gender group is, this is known as RDA. Next time you can also get what is RDA. Like you have actually got what is RDA. It satisfies the nutritional need of nearly 97 to 98% population, almost 97.5. EAR, estimated average requirement. This satisfies the nutritional need of 50% population. Clear? Okay, moving to the next question, guys. A 16-month-old child, 8 kg weight, on assessing in a growth chart, child falls below -3 st. What should be done next for management? Now, 16-month, 8 kg, is it okay? Do you think the baby is on track? 16-month-old child, 8 kg. Do you think the weight is okay? 16-month-old, 8 kg baby. The child is falling below what? -3 st. Very good. Severe malnutrition. You have to refer to NRC. Now you all know average birth weight of Indian baby is 2.8 kg. Weight doubles. When does the weight double? 5 months. Okay, weight doubles 5 months. Weight triples 1 year. And when does the weight quadruple? When does the weight quadruple, guys? 2 years. Okay, so if on an average it is 2.8, by 2 years the weight should be around 11 to 12 kg. So this baby 8 kg 16 month, ऐसे भी it is not a good weight for a 16. He's showing failure to thrive signs. Below -3 st means you will refer to a NRC. Clear? This is a growth chart. Like in WHO we have 2 lines, but in ICDS growth charts we have 3 lines, everyone. So I'll explain to you growth chart once we take up preventive obs and pediatrics as well. An Anganwadi teacher takes weight and height of a 4-year-old and finds out that height for age is below -2 st. What is the likely cause? Height for age is below -2 st. A basic question, what is height for age measuring, everybody? Height for age is below -2 st. So this is chronic malnutrition. Acute malnutrition is low weight for height, and it is what? It is actually wasting, or you could also call it as emaciation. Wasting or emaciation. And what is acute on chronic? What is acute on chronic? Acute on chronic means low weight for age. Low weight for age. The child is chronically malnourished, on it acute is superimposed. Yeah? Okay, let's go to the next question. Malnutrition is man-made and has many ecological factors playing a role. Which of the following ecological factor has a conditioning effect? Okay, so I'm not getting many correct answer here, guys. The correct answer over here is infections. The correct answer over here is infections. Look at this. This you will see in your textbook of Park also. There is a vicious cycle of, guys, infection and malnutrition. Alright, if a child is malnourished, malnutrition, suppose the immunities are poor, increased predisposition to infections. Now, if he is getting infected a lot, his malnutrition automatically suffers. So that is a vicious cycle. Clear? So the answer to this is infections. Alright, the answer to this is infection. Look at the question once again. Which of the following ecological factor has a conditioning effect? The answer is infections. Let's do this one. What is the answer to this? Diet, prudent diet is a diet for dietary goal achievement. Diet which contains variety of foods that prevent deficiencies. Diet on which a person group sustain. Diet which meets the RDA. So what are you going to mark for prudent diet, guys? Now I'll just tell you. Prudent diet is a diet for a dietary goal achievement, variety of foods that prevent deficiencies. Now see, this is a prudent diet. Can you see this? Prudent diet. So what is it having? It is suited for dietary goal achievement. It's not like it contains variety of foods. It's not like it is having iron rich food, it is having calcium rich food, it is having nitrogen rich food. It is simply that is meant for a dietary goal achievement. Look at the word. What is my dietary goal? Prudent diet. Prudent diet is something where the fat should be 15 to 30% total daily intake. This diet is particularly to prevent CVDs, guys. Saturated fat up to 10%. You can write 7 to 10%. Remaining fats unsaturated. Excess refined carbohydrates avoided. Look at this. Salt less than 5 gram per day. Protein 10 to 15% of our total daily intake. One more thing, cholesterol HDL ratio. Cholesterol HDL ratio should be below 3.5. Now this was a very basic question, guys. Prudent diet, they are meant to achieve certain specifications. Remember, what was balanced diet, guys? When do you say your diet is balanced? Balanced diet is protein. Proteins contain 10 to 15% of your diet comprise. Okay, if you talk about fats, fats comprise 15 to 30% of your diet and carbs comprise of 50 to 70% of your diet. But saturated fats in your diet should only be 7 to 10%. Remember this, saturated fat. So prudent diet or any specific diet like DASH diet, if I say DASH diet, this is a dietary approach to stop hypertension. Now this also has a particular dietary goal to achieve. A basic question. Don't mess up these questions, everybody. Try not to, okay? Alright. Which of the following is a reference protein? As quickly as possible you have to answer. Milk, meat, egg, pulses. So we all know reference protein is a protein which contains all essential amino acids. It has all essential AA and its net protein utilization is 96, which is like almost 100. Okay, so the answer to this is egg. Egg is the one where you will follow a rule of 6. What is rule of 6? Average weight would be 60 gram. एक average egg का weight 60 gram होता है. It gives us how much energy? 60 kilocalories. It has 6 gram protein. It has 6 gram fat. Maximum carbs. Alright, maximum cholesterol 250 milligram. ठीक है, cholesterol. It also has iron. It also has vitamin C. Okay, so these are couple of things that you must remember. Reference protein. Okay, let's go to the next question, everybody. Yeah, to check the efficiency of pasteurization, following tests are done except, this is a PYQ, guys. बहुत time हो गया, pasteurization आया नहीं है. Pasteurization has not come in the exam, but you never know, it can get repeated for any of the exams, guys. So let's look at this. If you can make out the answer over here. Pasteurization, efficiency of the pasteurization के लिए ये 3 टेस्ट होते हैं. Methylene blue reduction test is done before pasteurization. Okay, it is done before pasteurization. So let's quickly just read about this. See, phosphate test checks if milk has been adequately pasteurized. Coliform test identifies the presence of coliform bacteria. Standard plate count determines the total number of bacteria. These are tests to check efficiency of pasteurization. Has it been done rightly or not? But if you look at methylene blue reduction test, it is not used to check the efficiency. It is used to grade raw milk to pasteurization. This is done before pasteurization. And also you should know the methods: holder test, high temperature, short time method, ultra high temperature. We go for this method mostly, 72 degree for 15 seconds, okay, to remove all the milk-borne diseases. Basic question. I thought you might have missed out revising pasteurization, so why not do it? Now, a couple of vitamins. You all know vitamin A is the Bible of PSM. It always turns up in exams. Can you answer this? Can you answer this? Vitamin A. An 8-month-old baby on examination is showing signs of vitamin A deficiency. What dose of vitamin A to be administered to the baby? Now, the baby has signs. So, the baby is suffering. So, we will talk about the treatment dose, guys. Treatment dose. That means we are talking about secondary level of prevention. So over here you have to divide the baby up to 6 months. Then you have to divide 6 months to 1 year. And then you have to divide more than 1 year. Here you have day 1, day 2, day 14. Alright, day 1, day 2, day 14. Now when you have this up to 6 months, it is 50,000 international unit, 50,000, 50,000 international unit. Here it is 1 lakh, 1 lakh, 1 lakh international unit. Here it is more than 1 lakh, more than 1 lakh, more than 1 lakh, or you could just say more than 1 lakh. In fact, saying that is better. We will write 2 lakh international unit, 2 lakh, 2 lakh, 2 lakh. These are all oral doses, guys. But over here, there could come a question. Suppose there could come a question. The baby is a SAM child. What is the baby? The baby is a SAM child. That means if weight of baby, all right, weight of baby less than or up to 8 kg, irrespective of the age, the dose of vitamin A is going to be 1 lakh international unit. Remember this. For a SAM child, for a severe malnourished child, irrespective of the age, what is it going to be? It is going to be 1 lakh international unit. These are treatment doses, guys. These are not preventive doses. So here I was asked about treatment dose. Weight mentioned nahi hai. Weight ka koi lena dena nahi because it's not mentioned. So 6 months to 1 year. What will be your answer over here? 1 lakh international unit orally. 1 lakh international unit orally. Clear? Chalo. Let me give you one more question for your practice. Do this one. 2019. Vitamin A dose for a 2-year-old baby with keratomalacia. Can you see the different ways the question has been asked? Vitamin A dose for a 2-year-old baby with keratomalacia. So 2 years, that means what will you give? 1 lakh or 2 lakh? If the baby is 2 years, what are you going to give? 2 lakh? Followed by 1 lakh? Definitely not. It is 2 lakh only. So these are out. 1 lakh followed by additional doses? No. What is the dose over here? 2 lakh. Immediately followed by same dose 24 hours later and after 2 weeks. So the same way of asking the question, the same question could be asked in different ways. So this is like a different way of asking the question. These are all treatment doses. Remember about the weight of the baby though. Next question. Let's go to the next question. Now here you have preventive dose. Can you tell me the answer to this, guys? Preventive dose. What is the dose of vitamin A needed in children aged 1 to 5 years who are coming from areas that are endemic to vitamin A deficiency? Now at 9 months, at these Vani, we are talking about preventive dose right now. Alright, yeah. At 9 months, what is the dose of vitamin A? 1 ml or 1 lakh international unit. Thereafter, every 6 months, till 5 years, what are we going to give? 2 ml or 2 lakh international unit. So if you have to count the total doses here, the total doses would be 9, and what is the total amount here? It will be 17 lakh international unit. These are the preventive doses, and this is which level of prevention? Primary level of prevention. Clear? So what did you mark, everybody? 2 lakh, because it is 1 to 5 years. So 2 lakh international unit every 6 months till 5 years. Done. Treatment doses, preventive doses. Couple of more questions. Okay, what is the richest source of vitamin A and vitamin D? Anybody? Put in the comment section. Richest source, vitamin A, vitamin D. Vitamin A and vitamin D. What is the richest source of vitamin A and vitamin D? It's the same. Good SS. Halibut fish. It is halibut fish. Good Rupa, good Rohit, everybody. It is halibut fish. Cool. Let's go forward. Another way in which I am in this short, I am just giving you the different ways the PYQs have been asked, guys. Because in short, we are covering PYT. Alright, I'm not trying to teach you anything new here. We are just coming up with the repeated questions, repeated topics. So in vitamin A, this has also come. Xerophthalmia is a problem in the community if prevalence of bite or spot is more than 0.5%. Remember, xerophthalmia is the epidemiological indicator. It's the epidemiological indicator. This is the one we consider as epidemiological indicator. Now, where do you have the other findings? 1%. 1% आपको किसमें होता है? Look at this. Prevalence criteria for determining public health significance of vitamin A deficiency. You're going to look among 6 months to 6 years. You will do a survey among 6 months to 6 years old. Night blindness more than 1%. Bite or spot more than 0.5%. Corneal xerosis, ulceration, keratomalacia 0.01. Scar is 0.05. This you can read. Plasma vitamin A. That's, I would not say that important. If somebody asks you which is the most common symptom of night blindness, most common, vitamin A deficiency, most common symptom, or if they ask you most common presentation, the patient is going to come with night blindness. But what is the first sign that is noted? What is the first sign that is noted? That is conjunctival xerosis. But which is the most specific marker? Which is the epidemiological marker? And which is the most specific marker, guys? The most specific marker is bite or spot. Alright, which is also taken as an epidemiological indicator. The most specific is bite or spot, also taken as epidemiological indicator. ठीक है? एक और question, I will take you to the image and I'm going to ask you. Tell me the WHO gradings for these images. Tell me the WHO grading for image A and image B. What is the WHO grading for image A and image B? What is the WHO grading? So tell me the grading. Very good, Shaddeep. Everybody, this is bite or spot. Okay. Now bite or spot is a superficial raised area, a yellowish foamy triangular patch which is present on the temporal side of the bulbar conjunctiva. This one is X1B. And what about this one? This is drying of the conjunctiva. This is conjunctival xerosis. Conjunctival xerosis. This is what? X1A. This is X1A. The first sign. For WHO classification, you have X1A, you have X1B, you have X2, you have X3A, you have X3B. They are all primary findings. They are all primary signs. When we talk about X1A, conjunctiva, the first thing that gets affected, loss of keratinization of superficial epithelial cells. Conjunctiva, xerosis. This is what? Bite or spot. What is X2, guys? Cornea. Now the cornea gets affected. Corneal xerosis. What is X3A? Ulcer. Corneal ulcer. Less than 1/3 cornea. Less than 1/3 cornea. And what is X3? It is keratomalacia. or corneal ulcer only, but more than 1/3 of cornea, guys, and up to this stage it is reversible. Now corneal ulcer is not reversible, only these 3 stage they are reversible, rest 2 are irreversible. And if somebody asks you what about the secondary signs or what about the secondary findings, so that is what XN, night blindness, XS, scarring, and XF, fundal changes. Got it? Chalo, let's go to the next question quickly. What is the answer to this? 40-year-old female, no comorbidity, presents with acute onset of swelling in both legs. She also reports experiencing loose stools and her family members have similar symptoms. Upon examination, there was no sign of inflammation. This is very important. Non-inflammatory edema. Non-inflammatory edema. Think carefully. Is it BOA? No. Non-inflammatory edema, swelling in both legs, reveals mustard oil, contamination of mustard oil with argemone oil. So what is your answer over here? Sanguinary. This is a classic presentation of epidemic dropsy. What are your buzzwords? Non-inflammatory edema, acute in onset. न्यूरोलेथायरिज्म कभी अक्यूट नहीं होता है. न्यूरोलेथायरिज्म इज क्रॉनिक इन ऑनसेट, ग्रेजुअल ऑनसेट ऑफ स्पास्टिक पैरालिसिस. दिस इज अक्यूट इन onset. Let me show you some other question. Look at this one. All the possible PYQs that have come in NEET have been brought to this nutrition PDF. Okay, these have all come before. A worker at a groundnut factory developed food poisoning after consuming stale groundnut stored in the factory. Stale groundnut. They get infested with the storage fungus. What is the name of the storage fungus, guys? It is Aspergillus flavus. Aspergillus flavus, and this releases aflatoxins. Aflatoxicosis leading to HCC. Alright, let's go to the other question. Look how next time the question came. Man from Chhattisgarh has progressive leg spasms and muscle weakness with poor motor paresis. What history are you going to take over here? What history is more relevant? Past illness, recent fever, diet, vaccine history. This is a classic case of diet presentation you will take basically. Leg spasm, this is spastic paralysis. Spastic paralysis of lower limbs, and this is chronic onset. It sets up gradually. It doesn't happen like epidemic dropsy all of a sudden. So you have to take diet. This. What is the dal over here? Lathyrus sativus. Lathyrus sativus, or you could also say kesari dal. And this has got infested with what? This has got infested with the toxin BOA. Okay, so this is the table I have given for all of you. You can revise it later, the different forms of this thing. Toxin, what is the food item? You are mixing arhar dal, chana dal. Arhar dal or chana dal with khesri dal. Khesri dal was very easy to grow. It's a staple food. It was a staple food actually. ठीक है, spastic paralysis होता है. And how have we prevented it? We've banned the crop. Vitamin C could be used, parboiling. Last time also epidemic dropsy came, contamination of mustard oil with argemone oil, non-inflammatory pitting edema. Look at these tests. Nitric acid test and paper chromatography. Paper chromatography is the most sensitive test to check for argemone oil contamination. Guys, refer to my LRR which I had taken on Prep Ladder YouTube. Alright, on Prep Ladder YouTube, all these things we have revised there in a couple of 5 hours. So you, whenever like you approach very near your exams, you can get that. I have also shared the LRR PDF on my Telegram channel. Plus 4th June को हमारा one-liner का class है. 100 one-liners in PSM. Don't miss out that on 4th June at 5 PM. Alright, 100 one-liners in PSM. Cool. Chalo. Now let's do endemic ascites, crotalaria, junjunia seeds. We use it to contaminate millets, liver involvement, aflatoxicosis as well as aquatism. So you can go through that. Okay. Okay. Let's go to the next MCQ. Not MCQ. Image Characteristic 2-stick stage. This is Kesari dal. Alright, this is Kesari dal. This is characteristic 2-stick stage, particularly MP, UP, Bihar, Orissa. This is a classical case of neurolithiasis. Lawrence, we have already discussed. बच्चे RDA of calcium, pregnancy, non-pregnancy. Go to the beginning of the class. I have shown you a table also. Already discussed. Just उसको देख लो. The values are there in the table also, Lawrence. You'll find it. Alright, this one is Argemone mexicana flower, which was asked in INICT. Argemone mexicana flower. Alright, this is non-inflammatory edema. This one is epidemic ascites. Okay, alright, let's go to the next one. A homeless man. So food adulteration you are definitely going to discuss, revise and come for exam. Homeless man, diarrhea, dementia, dermatitis, primarily it's a product. What is that product? We all know diarrhea, dementia, dermatitis, delirium, depression, death. It can also lead to delirium. It can also lead to depression. It can also lead to death. It is nothing but maize. What is happening over here? Pellagra. Look, the other way also the question came. In a particular village, people are complaining of diarrhea, dementia, rash on exposure to sunlight. Questioning, it was reported that maize. So maize is niacin deficiency. Now what happens among maize eaters? Remember, that was a question which came in FMG exam. Among maize eaters, obviously tryptophan is limiting, but tryptophan gets converted to niacin. 60 milligram tryptophan gives 1 milligram niacin. But among maize eaters, there is excess of leucine. This excess of leucine would not allow tryptophan to get converted into niacin. Okay? And classic presentation, hyperpigmented patches over sun exposed areas. This one's over here, castle's necklace. Okay? And this you can see the person suffers from pellagra. This is a table which you can go through for a couple of deficiencies that I have mentioned. Riboflavin हो गया, niacin हो गया, maize eaters, jawar eaters हो जाता है, pyridoxine, peripheral neuritis, pyridoxine also seizures in infants. Alright, B9 you already know. B12 deficiency only in vegetarians. Remember that. This could be come in your exams. Okay, rest you can give a read through. We are doing the more common ones here. Alright, moving ahead. Let's come to our favorite health program. Anemia Mukh Bharat. What is the recommended? Beefy tongue. Alright, if you talk about beefy tongue, in B12, in B2 deficiency, it is magenta tongue. Magenta tongue, geographic tongue or glossitis. Beefy tongue is vitamin B12 deficiency. B12 deficiency is beefy. Okay. So what is the recommended iron folic acid for adult pregnant woman over here? 60 milligram elemental iron, 500 microgram folic acid per day. I'll show you the chart of this. Can you do first all the question on anemia Mukh Bharat? Can you first try out all the question, guys? All our interventions, this has never come. Ye kabhi nahi aaya, guys. This is something which can come as an expected MCQ. All our interventions adopted in anemia Mukh Bharat except. Very good. It is not early cord clamping. It is delayed cord clamping. It is delayed cord clamping. Of course, deworming is being done on the 10th of Feb and on the 10th of August, guys. Alright, deworming, national deworming days hai. Pregnancy में भी करते हैं. Okay. And additional non-nutritional causes of anemia. This is the chart that you can go through. Anemia Mukh Bharat under Ministry of Health and Family Welfare. Prophylactic iron folic acid, deworming with albendazole. Everybody is getting, even pregnant females. Behavior change, communication, delayed cord clamping. Testing anemia and point of care treatment. Wherever anemia is tested, treatment is provided. mandatory provision of iron folic acid fortified food, as well as addressing non-nutritional causes of anemia. And what are the prophylactic doses, everybody? So you can see the prophylactic doses I've already mentioned. 6 to 59 months bi-weekly, which is given in the form of a syrup. 5 to 9 years, 4 and 4, 45 milligram, 400 microgram weekly, which is given in the form of pink tar. 10 to 19 year is adolescent weekly. This is what? Blue tabs, which is blue tabs. Okay? Okay, reproductive age woman weekly, and pregnant and lactating women daily. Pregnant and lactating women daily. Clear? Everybody, will you remember these couple of points that I've given you for anemia? Shh, no talking. For anemia Mukh Bharat. Okay? Chalo. So this is prophylactic iron folic acid this thing. Tell me, what is the purpose of iron and what is the purpose of folic acid, guys? Iron is to prevent which anemia? Iron deficiency anemia. And what is the purpose of folic acid? Don't say to prevent NTDs. The purpose is to prevent megaloblastic. Nahi guys, anemia मुक्त, anemia से मुक्त होना है. तो prevent megaloblastic, close the door, prevent megaloblastic anemia. Prevent megaloblastic anemia. Don't say NTD. Chalo, let's have a look at one more question. What is the answer to this? The frontal anterior incisors of Delhi had white patches on them, turned brown following over supplementation of which of the following? Very good. This is fluorine. So just wanted to discuss a couple of things. Fluorine is a trace element, guys, and fluorine is a double-edged sword. Double-edged sword. Excess is also a problem and deficiency is also a problem. Okay? So look at this image. This very common. They love asking this, guys. Dental fluorosis. In this, what is the fluorine content? More than 1.5 milligram per liter. What is skeletal fluorosis? Skeletal fluorosis is 3 to 6 milligram per liter. And what is crippling fluorosis? Crippling fluorosis is more than 10. And what is the normal fluorine level in drinking water? What is the normal fluorine level? So the normal fluorine level, everybody, is 0.5 to 0.8. And this crippling fluorosis, how does it present with? What is this? Is it Genu-Val gum or is it Genu-Varum? This one is Genu-Val gum. With the gum, the knees have stuck. So what is this? This is knock-knee syndrome. Knock-knee syndrome. Varum is seen like this bow legs. This is Genu-Varum, which if you drink rum, you can't walk straight. Your knees will be pulled apart. So Genu-Varum is in vitamin D deficiency. Clear? Chalo, this one right here is dental caries. Dental caries, which is fluorine content is below 0.5. Dental caries, guys, remember, most common school health reported infection. Most common school health reported infection. Most common school health reported infection. What is the most common school health reported infection? Dental caries. And Nalgonda technique क्या था? Nalgonda technique was to remove excess of fluorine from water. ठीक है? Lime alum bleaching powder. Lime alum bleaching powder. It was meant to remove what? Excess of fluorine from water. Not lab. ठीक है? Okay. One more question out, guys. Which of the following food should be advised to a person suffering from CVD? So I want you to revise glycemic index a bit. इसमें आंसर क्या है? Whole grains. ये वाला चार्ट देख लेना, which I have put out in the PDF. Low GI foods, most fruits and vegetables except potato, except potato and watermelon. Except potato and watermelon. दीदी को बुलाओ. ठीक है. Chalo, what is the answer over here? Good. Highest content of essential fatty acids, safflower oil. Now, just wanted to revise, guys. Which is the most essential fatty acid? Which is the most essential fatty acid? Which is the most essential fatty acid? Most essential is linoleic acid. Linoleic. Now, linoleic omega 3 है या omega 6 है, guys? कैसे याद किया हमने इन आर वीडियोज ऑल्सो. लाइनोलिक इज अ स्मॉलर वर्ड, बिगर नंबर, ओमेगा 6. बट इफ यू टॉक अबाउट लाइनोलेनिक, it is a bigger word, smaller number, omega 3. Which one is more cardioprotective? Which one is more cardioprotective? More cardioprotective is omega 3. More cardioprotective is omega 3. ठीक है. So safflower oil, sunflower oil, they are all rich in PUFAs, polyunsaturated fatty acids. ठीक है. Coconut oil and butter, coconut oil and butter, they are rich in what? Saturated fatty acids. Saturated fatty acids. ठीक है. Palmic, stearic, all those are saturated. Polyunsaturated, you have monounsaturated oleic acid, which is olive oil, and you also have polyunsaturated, which is which one? Linoleic and linolenic. Last slide was this one, guys, where I had just mentioned low GI foods, moderate GI foods, as well as high GI foods. So this you can just read on your own, that we should always go for low GI foods. What is deficiency of essential fatty acids called as? Deficiency, where the person develops a toad-like skin, it is phrynoderma. Phrynoderma. Clear? Okay. One more thing I wanted to discuss with you. Quickly mark karo. Last thing that we are talking about is iodine. Most sensitive indicator of environmental iodine deficiency. So guys, India में ना एक program है, National Iodine Deficiency Disorder Control Program, according to which in endemic zones, wherever iodine deficiency is endemic, we believe in providing prophylactic products like iodized oil, iodized salt, double fortified salt. Now what is this? Double fortified salt. In the salt you will have iron and iodine both. ठीक है. जीवन बिंदी, what is जीवन बिंदी? If they give you an exam, जीवन बिंदी is life saving dots. Don't write for TB. Life saving dots agar likha hoga, that's to prevent iodine deficiency. There's a bindi that the women wear which is constantly releasing iodine. And similarly they give you some questions like environmental iodine deficiency. Most important is to check for neonatal hypothyroidism rate. Remember, neonatal hypothyroidism is the most common preventable cause of mental retardation in children. If you are able to prevent neonatal hypothyroidism in the first 7 days of life, the child can be stopped from getting mentally retarded. Okay, so this is it. A couple of points you will go through for iodine. Median urinary iodine excretion is used in epidemiological assessment of iodine deficiency. This can come as an MCQ. So if they ask you environmental deficiency, neonatal hypothyroidism. If they ask you epidemiological assessment of iodine deficiency, median urinary iodine excretion rate. If they ask you impact of the program, you can go for this one. Serum T4 level is more sensitive indicator than T3. And we also have quality control of iodine and salt is performed by rapid testing with MBI kits. This is MBI kits. We have MBI kits provided by UNICEF. Clear? Chalo, last question. Although it came in INICET 2022, but kyunki anemia mukh Bharat is such a loved question, they could ask you the treatment. So how do you manage the treatment? कैसे मैनेज करते हैं? Let me take you to the explanation. Guys, सबसे पहले याद रखो आयन देते ही नहीं है. Now what is the cutoff for anemia? Cutoff for anemia in pregnancy is hemoglobin below 11. 9 to 11 is mild, okay, and if you have 7 to 9 it is moderate, and below 7 it is severe. So how will you do it? I brought a table for you. You can go through this. Mild to moderate anemia. Gestational age below 34 weeks, more than 34 weeks. Below 34 weeks, you have to give IFA, 2 tablets, not 1. 1 was prophylactic dose. If not tolerant to IFA, then only you can give IV sucrose or IV FCM. You will not give IM. But if the gestational age, whether it's mild to moderate, but gestational age is more than 34 weeks, you will not go for tablets. You will go for IV injections. But the problem arises severe anemia. Alright, whatever be the situation, first or second trimester, IV only you will give. You will not give this one, IM. Okay? In the third trimester, you immediately have to hospitalize. So if there is a plus, you have to go for blood transfusion. If, remember, IM to kabhi dena hi nahi hai. Okay? IV hi dena hai. Am I clear? Everybody, will you remember this? First thing, mild to moderate, you can give for 2 tablets. So here, if the question was 34 weeks pregnant, mild to moderate. What is it? 34 weeks. 2 tablets. But suppose she can't take 2 tablets. 3 tablets? No, it is 2 tablets. IV, 2 iron and folic acid plus IV iron sucrose? No. What is left? IV only if she can't tolerate oral tablets. Okay? ये जो couple of tables are there in the PDF, go through these tables, guys. These are the ones that come in your exam. Okay, so that's it for today. Okay, one more thing. FSSAI is National Food Standards. National Food Standards. Food Standards and Safety Authority, India has said this. Codex Alimentarius. Codex Alimentarius is what? Codex Alimentarius is International Food Standard. International Food Standards. जिसको किसने बनाया था? WHO ने and FAO ने बनाया था. ठीक है? This one. BIS, Bureau of Indian Standards. Quality above excellence. Quality, we desire quality above excellence. We will have a BIS mark. But if we want minimum quality, minimum quality के लिए you have a act which is PFA Act, Prevention of Food Adulteration Act. क्लियर. एगमार्क इज फॉर, एगमार्क का लोगो ऐसे है, एगमार्क एग्रीकल्चरल, शब्दीप, एगमार्क इज फॉर एग्रीकल्चरल प्रोडक्ट्स. Tomorrow when we take up NHP, I will tell you about पोषण अभियान as well as ICDS. वो हम लोग कल डिस्कस करेंगे. ठीक है. So that's it for today everybody. Glycemic index का मतलब होता है SP, Dr. SP. Whatever food you have, your glucose will rise. So what are, in very simple terms, what are the food products that are going to increase your glucose very quickly? And you compare it to a standard. A standard is glucose itself, or syrupy foods, or chocolatey foods. Okay? So you should always have food products which don't raise your glucose quickly on consuming low GI foods. Okay? I think I hope I was not in too much of rush today everybody. You understood, right? I will share the PDF, don't worry. All the PDFs are in the Telegram group. Keep revising. We are left with a couple of more classes. On 4th June, you have 2 classes, guys. You will also have 100 one-liners. You will also have 100 one-liners. This is on PrepLadder YouTube. This is on PrepLadder YouTube. Okay, PrepLadder YouTube. Don't forget to attend 100 one-liners PSM as well. RDA में reference नहीं, RDA is recommended dietary allowance. See, there are so many people, Ambika, there are so many people there. For everyone, I can't frame an RDA. That, okay, Ambika needs this much, Neha needs this much, let's say Harsh needs this much calorie. We can't do that. So what have we come up with? We've come up with the criteria of reference man and reference woman, for whom we have designed the RDAs. There is something which is known as estimated average requirement. On an average, how much should I eat? But sometimes people fall sick, sometimes people are fasting. So you always go for the extra. You always have to remember RDAs, which are extra than the average. Okay, which satisfies the need of 97 to 98% population. Okay, everyone. So thank you so much. This is at 5 p.m. guys on 4th of June. 5 p.m. on PrepLadder YouTube. Okay, I'll remind you again on 4th of June when we meet for our usual 12 p.m. class. After that it's there, so I'll remind you. Okay, bye bye, have a good day, enjoy your Sunday, keep studying guys, keep revising, don't give up. MCQ karo, GT do, analyze GT in the same day. Don't be worried, don't leave out any subject. If you're not able to revise any subject, just at least go through the PYQs, NEETPG and FMG both. You will do it very well. Okay, man lo you are not able to study some XYZ subject now, just at least pick up the PYQs, watch the LRR. I'm sure you will be able to get through. Okay, thank you so much, bye bye, have a good day guys.